Hello everyone, I'm Faraidoon. It's like a month or more than a month that I have been planning to record this video, but it's not happening. One day I am very busy, one day I'm tired, one day I say I have to shave and look better. Today, I decided to do it today, but I have all of them. I am tired, I was very busy, I'm not beautiful, but I decided to record this video and finish it because I feel like this is a useful video, I have to make it, and so I'm not gonna waste the time anymore. So I'm Faraidoon, I'm a medical doctor, general practitioner. I received my PhD from University of New South Wales. Now I am a research fellow at the George Institute for Global Health, and I'm focused on headache disorders. Today, I want to talk about this paper that we have published recently with my previous supervisor, Professor Toa. The ways to manage migraine that doesn't involve taking medication. It doesn't mean you shouldn't take medication. If your doctor has prescribed medications, you have to continue the way they told you. These are some information that you can follow alongside with your medications and will help manage your migraine better. And remember, like every other videos that you see online, this is not gonna be used instead of your doctor. So if you have any question, if you want to change something, if you want to use something, discuss it with your doctor before doing it if you are worried. These are just information. It doesn't mean that I'm prescribing it for you. Things can be different from one person to another. So discuss with your doctor. Maybe some of the points are not useful for you, but are useful for another person. So please make sure you discuss things with your doctor. Let's start. So this is table 1 in the paper. What are the benefits of having non-pharmacological ways to treat migraine? So the first one is like some people, they have side effects when they take some medications. Some people, they prefer not to take medications, which can be again because of the side effects or for other reasons. Medications sometimes can be expensive. Some medications can cause medication overuse, headache, and sometimes you don't get the result that you expect from taking the medications. Sometimes during pregnancy or breastfeeding, you have limitations on the medications that you can use. So we have another paper, hopefully will be published soon, and then I will make a video about how to manage migraine during pregnancy and breastfeeding. Sometimes you have another disease, or you are using another medication that the migraine medications are not going well with those other situations, so you have to avoid them. And generally, sometimes you just want to use it medication, like non-pharmacological ways for management of migraine to help your medications. So you are using them for acute attacks for prevention. So you also add these things which can improve the overall outcome. So the first step is to know some triggers. There are some triggers that can cause attacks in people with migraine. So the first step is just to know them. Then if we can avoid them or control them or learn how to live with them. So I will talk about some of them later. This is table 2 in the paper. I will put the link to the paper in the caption or also at the end, so you can read the paper and see this table. And I will talk about them. Just something that I noticed that in this room that I am, suddenly this camera of the laptop is changing the brightness of the screen. Sometimes it became all dark, or sometimes my nose is glowing, and so, but I'm not gonna stop recording. I'm gonna finish this. I promise next time I don't select this room, I will go to another room. Hopefully the brightness is fine, so sorry about that. So there are some triggers that are reported by many patients, people living with migraine, that they have these factors as a trigger for their migraine attacks, which is stress, change in sleep, fasting, caffeine consumption, anxiety, neck pain, light stimulations. So about caffeine consumption, I should just say that some people say that, but caffeine is a painkiller. Yes, it is a painkiller, but if you use it in a normal way, if you overuse it, caffeine can also cause headache if you use it too much. Or if you have always used caffeine and you stop using it, that can also be a reason for migraine attacks. So be careful about that. We published a paper. It was about during COVID. It was about the impact of COVID on migraine. But we had one table that we asked people. Many people were asked. These were like users of an app called Migraine Buddy. The users reported these triggers as the most experienced triggers: stress, lack of sleep, neck pain, and anxiety. Also, some people reported interruption in sleep, and some people say that change in weather. So these are the triggers that are reported by most of people living with migraine. So maybe you have different experience, maybe there is something else that triggers your migraine attacks. You can check that in yourself, but these are the reports based on the studies. So something that is very important is combination of triggers. For example, let's say it's the time for menstruation. I forgot to mention that. I haven't added, it looks like menstruation in the previous slide, but menstruation is very famous trigger for migraine attacks in females, like super common. And I should have mentioned this one actually in the previous slide, but I have one slide specifically for this one. So let's say it's like menstruation, and then you are working a lot, which getting tired is another trigger. You are very busy, you don't have time to eat lunch, which is fasting, another trigger, and also you don't drink enough water. So all of these things are connected to each other and then increases the chance of your migraine attack. So you have to be careful about the combinations. So if it's like the time of the year or months that you think you might have higher chance of migraine attack, try to remove the other triggers. For example, eat well. If you go to beach, especially here in Australia, if you go to beach, you have a sunnies. Try to reduce the sunlight to your eyes. Drink well. Try not to be dehydrated. And if you can, remove the other triggers or control other triggers to make sure that you are not combining different triggers on top of each other. In general, it's impossible to control everything. Sometimes we become so focused on controlling all triggers, everything, it becomes another source of stress. And also we blame ourselves that it is our fault. But I have also migraine disease, and I know that it's impossible. Like, for example, I will have a slide about stress. I would say, for example, we have to manage stress, but how? Like, for example, right now I have an ulcer in my mouth, and it's stress related. So if I could manage it, I wouldn't have that ulcer. So, but we should just remember, if we can, we avoid the triggers or control them or try to learn how to live with them. If everything is done and still the things are around, it's not our fault. It happened, and at least we shouldn't blame ourselves for, if I have a migraine attack, it was my fault. I did this. I could prevent this. No, that's it. It happened. So having a migraine attack by itself is enough. Blaming is not fair to add to this situation. So yes, sometimes we cannot control it, or we shouldn't be putting a lot of stress on ourselves just because we have to control everything. So there are some environmental factors like high altitude, heat, weather changes, I don't know, strong smell, uh, things like that, perfumes. So if we know them, we might be able to control that. So some people ask like, okay, what can I do? How can I prevent weather change or like things like that? So for example, an example that I always mention is, let's say I'm gonna travel, especially from Australia to everywhere in the world. It's like takes a few days, and you're going. It's like there is a high altitude. You might have lack of sleep, like the stops in different airports. So there are a lot of triggers that might possibly start your migraine attack. So what I do is, or what I say people should do is, try to at least eat well if we can, have enough water, make sure we have our medications with us if needed, we use them, and try to reduce other risk factors, other triggers if we can. If we cannot, it happens, it's fine. And we can, if it always happens during travels by planes, we can discuss with our doctor how to prevent it or what to do. So another thing is, for example, if you know that you have a family member or a friend or a colleague, someone that has migraine and is very sensitive to perfumes, try not to wear perfume when you go to work or when you are near that person. So these simple things, which part of all of these non-pharmacological methods is education that we have to teach not only the people with migraine disease, but their families, their colleagues, people around them about the triggers that to learn that actually just not wearing perfume can help your colleague, for example. But sometimes we cannot even control that. So these are just information that is good to know, and maybe one day we can control. So one Important trigger is lack of sleep or bad sleep or irregular sleep or having sleep disorders. So we have to try to manage them. So here I have put, this is mentioned also in the paper. This is part of the paper, the screenshot. So you can read the paper or stop the video and read this. So there are some techniques that you can have a better sleep. But for example, one of them is not to use TV or phone or things like that in the bed, which I sometimes do that, or not having a nap during the day. Ask me everything, don't ask me not to have nap. So it's just like you have to find your thing. So, but generally speaking, these methods are very helpful if we can follow them to make sure we have a good sleep. But sometimes we have, I don't know, a nose polyp or something that we have to discuss with the doctor because it gives us problem with breathing or snoring during sleep. That's a different story you have to discuss with your doctor. But if everything is fine, following these steps can help you to have a better sleep. The other thing is dietary modifications. The most important thing is skipping a meal or fasting, things like that. So this can trigger migraine attacks, so be careful about that. So the other things is dehydration, some other food that the lists are here, chocolate, wine, alcohol, and things like that. So sometimes we have to check different food for ourselves. Maybe the things that are mentioned here, I don't know, someone can say that onion, but it's not triggering your headache. So check what food is triggering your migraine attack. Sometimes it's good to have a headache diary and also a food diary, which is a lot of work, but anyway. And then you can see if there is any pattern with any food, with any attacks. So sometimes the attack happens not exactly, it's not like you eat and then you have the attack. It can happen in 6 hours, 12 hours, the day after. So it's good to just find out if there is any food that triggers your migraine attacks. Then you can probably prevent it or be ready for that. So another thing that can help is doing regular physical activity. This one can prevent future attacks. Yeah, look, it is different from physical activity during attack. So physical activity during attack can make it worse, like your attack might get worse. So we're not talking about that. Sometimes physical activity can also become a trigger for your migraine attack. But generally speaking, if you are doing physical activity in a not in a very severe form, like making yourself super tired, but in a moderate way and drinking well, staying fit, it can, in the long term, can help with reducing the number of attacks. Okay, management of stress and anxiety. There are many ways, but you have to find your own way. I have kept it empty like this because honestly, I don't know what is the best answer to this. So there are many ways like relaxation, discussion with other people, with talking with experts and specialists, going to psychologists and psychiatrists, discussing with them, talking with your doctor, what is the best way to solve it, learning new skills, try to avoid some stressful situations if we can, or learn how to live with that, cope with it. What I can say that it's a trigger. It's good to try to find a way to solve it or live with it or cope with it. So please discuss with your doctor and read more about it and find ways that works for you. It can be yoga, it can be meditation, it can be going to a holiday, it can be doing exercise, being with friends, doing group sports. So there are many ways that we might be able, sometimes getting away from social media. So there are different ways, but please try to find your own way. Weight reduction is also another useful way. There are evidence that reducing your weight can help with preventing future attacks, having less attacks. We did a study and we found that reducing the BMI, like technically reducing weight, means that it helps with having less attacks, less severe attacks, and helps with better managing your migraine. So this is an option you might consider if it works for you. Sometimes we have other disorders that we really need to manage them first, then it helps to manage our migraine disease. For example, depression, stress, anxiety, or like in some people like with hypertension, high blood pressure, or like some sleep disorders like sleep apnea and things like that. So sometimes it's good to consider other disorders that we have and discuss it with our doctors, and maybe solving them can solve our migraine. There are some other methods that can help management of migraine, which can be like relaxation techniques, stress management, biofeedback, and things like that. So you can discuss these things also with your doctor or with people that have knowledge in this area, and try them and find out if they work for you. But make sure you discuss with your doctor. And we discussed that improving knowledge, like both in patients, people living with migraine disease, or their family, friends, colleagues, and general population, will help a lot in managing migraine in general. Neuromodulation techniques. There are some devices that you stimulate the nerves peripherally, like in the neck, arm, or centrally on the brain, that there are good evidence that they might help with prevention of future attacks, or even stopping the attacks that you are currently experiencing. So this is also another thing that you can discuss with your doctor. Check if there is any device that is available for you in your area, in your country, or you can use it and it's safe for you. And this is also another option that might be considered. Also, there are some dietary supplements that you can discuss with your doctor, again, like vitamin B2, coenzyme Q10, or magnesium. This might work. In some people it works. So don't start having this, even if it's called supplement, but do not use them until you discuss it with your doctor. But you can discuss it and see what they think. So that's it. And this is a summary, table 3 in the paper. If you read the paper, you can learn more. So I hope this video has been useful. Let me know if it was useful, if you have any question, if you have any suggestion for future videos. I really appreciate it. This is the paper. If you scan this QR code, you can find the link, or you can search it. The full text is free available. So it's so easy for you to download it and read it. The way we have written it, we try to make it in a way that is easy to follow, not having technical terms. So I think it can be a useful source for you if you like to learn more about how to manage your migraine with methods that doesn't need medications. But it doesn't mean, again, I tell you, it doesn't mean that you shouldn't take medication. These methods are very helpful if you combine them with your medications. So it can help having better effects from your medications, having less side effects, managing it better. You might need less medications, and always discuss everything with your doctor. Yeah, that's it. Thanks for listening, for watching this. Let me know how you think about the whole video, and more videos I will try to make and put them in this channel. Thank you so much. So like how I always finish my videos or my presentations, I say that I'm Faraidoon, but if you cannot remember my name, remember my big head and my field of study, which is head pain. Thank you.